Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Good afternoon, everybody. We are going to be talking about a lot of green foods today and lots of other color foods today, as well as we dive into the inflammatory or anti-inflammatory diet. So as Lauren said earlier, we will try to have a couple minutes for some questions at the end that we can go over if there's anything that we missed. But without further ado, let's dive into the material. So just a little roadmap of what we're going over today. We're going to talk a little bit in the beginning about the link between inflammation and cancer, or really just health in general. We'll have a little mix today of some science, maybe some science terms, as well as practically how we can put this information into use on our plates. We're going to talk about dietary and lifestyle habits that can increase inflammation, and also some habits that we can implement to help lower inflammation. So let's start by going over some of the basics. What exactly is inflammation? What does that word mean? It typically has a pretty negative connotation. But what inflammation is it's the body's immune system response to an injury or an irritant. It's actually pretty important for us to have inflammation. Some of its purposes, it destroys invaders, pathogens, viruses, things like that. So, for example, if you have a common cold, which I am recovering from, so if you hear me clear my throat, please forgive me. But when you have something like the cold or the flu and your nose gets all puffy and swollen, you maybe have headache, maybe we are having congestion, that is good inflammation to help your body fight off the pathogen. It can also help isolate damage, keep it localized to one area. Inflammation is part of a process to repair damaged tissues, and it acts as a warning to our body systems. Some of the common symptoms of inflammation are pain, redness, heat, swelling, or loss of function. So a perfect example is if you're out on a run, you trip, you sprain your ankle, you're initially going to feel pain. It's going to become swollen, red. You might feel the physical heat, and you're probably not going to be able to walk on it. That's your body telling you, hey, I need to repair. But some of our symptoms of inflammation can also be silent. This is oftentimes associated with chronic inflammation. So inflammation can be either acute, meaning immediate, short term, like having a cold or recovering from that swollen ankle, or it could be more long term. So what are some of the causes of inflammation? Well, we just talked about a little bit the germs or pathogens, bacteria, viruses, fungi, and injuries. But it can also be caused by things like our environment, maybe environmental toxins like chemicals, maybe we're working with a lot of heavy duty chemicals, or just generalized pollution. But it can also be caused by lifestyle factors. So this is where we're focusing most of our attention on today because this is what we can address the most. Some of the lifestyle factors that cause inflammation are things like chronic stress, obesity, which we'll talk a little bit later about how exactly obesity affects inflammation, alcohol and tobacco use, inadequate sleep or poor sleep quality can increase inflammation, low levels of physical activity, and poor diet quality can also affect inflammation. So, most of these lifestyle factors are going to lead to the chronic inflammation, the longer term. This is what happens when our body signals inflammatory cells or an inflammatory response, even if there isn't danger. One kind of analogy for this is we have our adrenaline, we have our fight or flight response that turns on when there's immediate danger. With chronic inflammation, that fight or flight response doesn't get turned off. So that adrenaline or that response that's supposed to be short term lasts a lot longer. Conditions that end in itis are often a sign that they are an inflammatory condition. So things that you've heard regularly, maybe rheumatoid arthritis, gastritis, bronchitis, and even psoriasis are all inflammatory conditions. While inflammation is meant to help our body, it's a normal biological process. What can happen when it's chronic is it can end up hurting our body. Some symptoms of more chronic inflammation could include things like fatigue, joint pain, maybe abdominal pain or gut issues, sudden or unexplained weight gain or weight loss, mood disorders, we could have fever, and the list really goes on and on. Now, I do want to point out that just because you have some of these symptoms does not necessarily mean that the cause is inflammation. It could be something else. For example, fatigue. Maybe we didn't fuel properly that day. Maybe we exercised too much and didn't eat enough, and now we're tired. Um, but these are some of those symptoms that if they're prolonged, if you're dealing with more than one, it certainly can be worth looking into. So, what are some of the consequences of long-term inflammation? So, unfortunately, a lot of chronic diseases are inflammation driven. So, just looking at a couple here, with cardiovascular disease, what can happen is that chronic inflammation can actually lead to plaque buildup in our arteries, which over time could lead to heart attack or stroke. Or with metabolic disorders like type 2 diabetes, an example might be that insulin resistance causes immune cells to infiltrate our fat tissue. Autoimmune diseases and joint diseases like rheumatoid arthritis are often a result of the immune system attacking healthy cells, which is a part of the inflammatory process. Or chronic disease, or chronic inflammation can cause or worsen digestive diseases or even skin diseases. So that psoriasis we mentioned, maybe Crohn's or irritable bowel syndrome, those could be inflammation driven. And then, of course, cancer. Um, Persistent low-level inflammation can actually damage DNA, causing tissue damage, and in some cases could even promote tumor growth. So these are just a snapshot of some of the ways that inflammation can affect um, chronic diseases. We could take each of these one by one and have a whole PowerPoint on that alone and still barely scratch the surface. But overall, what you can tell is we want to limit this long-term inflammation to hopefully help lower our risk of chronic diseases. So as we move forward in the presentation today, a couple key points to remember. Number one, not all inflammation is bad. Kind of like how hormone becomes a dirty word, but hormones are also important. We'll actually talk about a couple of hormones today throughout the presentation because some of them can be linked. There are times when we intentionally induce inflammation, especially when we talk about cancer treatment. Chemotherapy, immunotherapy, radiation therapy, vaccines. Even prolotherapy, which is when we do an injection into some of our ligaments to reduce inflammation. All of these are intentional, controlled, and helpful in order to help our body heal. So, what can we do about inflammation? I always like to start with foods to limit and then end on a high note of what we can add in. So let's start by talking about what foods we can limit or eat in moderation or maybe avoid altogether in order to lower inflammation. We're going to start with a hot button topic, and that's ultra processed foods. Now, an ultra processed food doesn't have a clear definition. The FDA doesn't regulate ultra processed foods in terms of a specific category. So I want to start by prefacing that not all processed foods are necessarily bad for you. For example, a baby carrot, one that's been washed and cut for you, is not what we consider an ultra-processed food, even though it's been processed because it's been washed and cut. We know that that would still be a healthy choice for us. But with the ultra processed foods, we're talking a lot about packaged foods, maybe foods with a really long ingredient list. You don't recognize many of those ingredients, or foods that have a lot of additives, so on and so forth. Ultra processed foods are linked to inflammation because of several different mechanisms that we've identified. We know that they're linked with increased chronic disease risk with the more ultra processed foods we eat. They're also linked with gut dysbiosis, aka leaky gut, or just a maladaptive gut bacteria or gut microbiome. Ultra processed foods are linked with elevated inflammatory markers in the blood. So we've seen some studies that when we looked at folks with higher processed food intake, they have also seen increased inflammation in the body in our blood work. Ultra processed food, high intake of it, can be linked with inadequate nutrient intake because maybe a lot of these UPFs might be stripped of some of the beneficial nutrients that we need to help lower inflammation. They also tend to be lower in fiber, and fiber is important for fighting inflammation because it really helps to feed the good bacteria in our gut. So maybe you've heard of probiotics. Probiotics feed on fiber, and as a result of this process, they create certain metabolic byproducts that help our body fight inflammation. Short chain fatty acids are one of those byproducts, which are actually really helpful for gut immune function and overall reducing inflammation. So, in order to kind of mitigate some of these negative consequences of a diet high in UPFs, there are certain things that you can look for when you're buying food to just kind of keep in the back of your mind. So, if you're looking at a product, things that have additives or emulsifiers is likely a sign that it's an ultra processed food. If it has nitrates or nitrites, like in our processed meats, or if there are refined grains, meaning not a whole grain, a carbohydrate that's really low in fiber, that's likely a sign that it's a UPF. If there's a lot of added sugar, added salt, or added saturated fats, that could be a sign it's a UPF. Or if a food includes trans fats, that is a big red flag that it's a UPF. So more specifically, let's look at some of the foods we want to limit. So again, processed meats, which often have nitrates, nitrites, or other additives to them, are a known carcinogen. We do see that they're linked with increasing inflammation, particularly in the colon, which can lead to colorectal cancer risk. So our processed meats are going to include things like bacon, breakfast sausage, deli meats, pepperoni, and hot dogs. Now, if you've been to any of my presentations before, you know that the American Institute of Cancer Research actually recommends that processed meats be avoided as much as possible. Whereas some of these other items, we can have in moderation. Maybe they're not a direct cause of cancer, but we just don't want to eat them excessively. For example, those refined grains or those low fiber processed grains like pastries, certain crackers, certain bread products, maybe certain snack foods or pastas. We also want to limit our sugar-sweetened beverages, things like sodas, sweet teas, sugary coffees, punches. This high sugar intake over time can lead to some inflammatory responses like insulin resistance. Again, packaged foods with trans fats. This is trans fats aren't really something that you'll get from whole foods. You'll only see it in our processed foods. We'll also want to limit deep fried foods like fried chicken, donuts, fair food, if you want to think of it that way. And then again, foods that have a lot of added sugars, like our sweets, maybe some flavored products, sugary condiments. Those are best to have in moderation as well. A lot of the recommendations for added sugar recommends limiting them to about 25 grams a day. So this is the number that I like to use. Um, so 25 grams of added sugar or less per day. Keep in mind if that's going to come from a food, if that's going to come from your sugary beverage, you want to take a look at all of that. All right, we also are going to want to limit our alcohol and our tobacco products. So these are both known causes of inflammation as well as known causes of cancer. So they are carcinogens. Now, most of us know that tobacco products and smoking increases cancer risk. That's been well established for a few decades now. But actually, one of the things that happens with tobacco products is when it increases inflammation, it can actually deplete your body of some of the nutrients that help fight inflammation. So it's kind of a double whammy with tobacco products. Now, alcohol is also a known carcinogen. We have linked it as a known cause of at least 6 cancer types, including pancreatic cancer, postmenopausal breast cancer, head and neck cancer, but really we suspect alcohol is linked to almost every cancer type. We don't have a safe amount of alcohol to consume before we start to see an increase in inflammation. Really, we see an increased risk with any amount of alcohol. But the American Institute of Cancer Research advises that women limit alcohol to no more than 1 drink at a time, and for men, it's no more than 2. Now, that doesn't mean 7 drinks a week. They go further to suggest less than 4 drinks total per week. But again, really, the least amount you can consume alcohol or use tobacco products, the better. Okay, so now that we have established some foods that we want to limit, let's talk about what we can add in, and then we'll move into some other lifestyle factors. Before we specifically talk about foods, I want to give a little bit of background to understand why exactly we're recommending specific foods. So let's talk about antioxidants. So, antioxidants are a really beneficial compound for our body that can help neutralize something called a free radical. So, a free radical is an unstable molecule that is a natural result of metabolism. But when we have other, causes of inflammation like pollution, tobacco products, these free radicals in our body can build up. They're dangerous because they're missing an electron. So you'll see here it says an unpaired electron with a little red circle. That electron wants to pair. And what the free radical will do is it will go and try to pair with proteins, lipids, other molecules in our body that causes damage in that process where it's binding. We call this damage oxidative stress. It's another word basically for inflammation. Well, antioxidants are helpful because they've got a lot of extra electrons, so they can donate it to the free radical, stabilizing it and limiting the damage that oxidative stress can do to our body. So if you didn't follow any of that, which is perfectly fine, basically what we want to take from this is that antioxidants are helpful in limiting inflammation in the body. So with that being said, how do we get antioxidants? Well, we really get them through our plant foods. Plant foods are going to be our friend. Not only do they contain these antioxidants, but they also contain other beneficial or anti-inflammatory benefits. So antioxidants can either be specific vitamins. For example, vitamin C, vitamin A, vitamin E are all antioxidants. But compounds that exist in our plant foods that give them their color, their flavor, their aroma are polyphenols, and they can also act as antioxidants. Now, plant foods will also contain fiber. As I mentioned earlier, fiber helps to feed the good bacteria in our gut, helps to strengthen our gut, prevent something like a leaky gut. And it also has those metabolic byproducts that are really helpful for our body. So, the American Institute of Cancer Research recommends that we aim for 25 grams of fiber a day as a minimum. It's a little bit more for men. We recommend about 30 to 35, but we'll just call it 25 grams today, because that's our magic number. We want 25 grams or more of fiber if we can tolerate it, and 25 grams or less of added sugars. So again, not total sugars, but added sugars. Now, to get there, in terms of cancer prevention, we recommend 7 to 10 servings of fruits and vegetables daily. Now, if that sounds like a lot to you, let's remember a serving is going to be about half of a cup's worth of a fruit or vegetable. So aiming here for about 3.5 cups of fruits and veggies. Now, the dietary guidelines has usually recommended 2.5 cups of fruits and vegetables a day. But what we know for chronic disease prevention, for fighting inflammation, it's best to get even more than that. If that feels really overwhelming, what I would recommend is just pause today, think about on average how many servings or how many cups you get of fruits and vegetables a day, and one by one start to increase that amount. Every little bit extra that we add in will help. Something I often hear about when I speak with patients in my practice is I always try to make sure I have a green at dinner. But I want to note that these phytonutrients, polyphenols, antioxidants, they don't exist just in our green foods. We'll see this a little closer up in a second, but we want to aim for a wide variety of color in the diet. So we don't want to limit it just to spinach and kale and broccoli, but we also want to add in things like carrots, red cabbage, purple eggplant, our colorful berries to really maximize the anti-inflammatory nutrients. So here I've kind of broken down some of the different colored phytonutrients and some of the potential benefits of them. So I'm not sure I'll go through these one by one, but this is just to give us a little snapshot of some of the research that's been done on the beneficial effects of these phytonutrients and antioxidants. So our red and our purple produce has something called anthocyanins. Studies have shown that these can help inhibit or slow tumor growth and block cancer cells from proliferating or essentially growing and multiplying. Our red, tomatoes, grapefruit, some of our other red produce has what we call lycopene. This is actually a phytonutrient linked with inhibiting the growth of prostate cancer and possibly lung cancer because of its anti-inflammatory properties. So for men, we actually encourage a couple servings of lycopene-rich foods a week. Our orange and our reds, like our carrots, have something called carotenoids, linked with improved eye health and then maybe even skin protection against UV radiation. Other oranges and red and yellows, excuse me, have something called cryptoxanthin. These are possibly linked with anti-osteoporosis effects and can help fight damage from smoking. So, this kind of goes on. We've got our whites, our allele sulfides and flavonoids can actually promote cell death of certain cancerous cells and limit cytokines, which are an inflammatory molecule in the body. So we don't have to know these, individually. We don't also want to just pick certain antioxidants and just try to get that. If we're eating a well-balanced diet with a variety of foods, aiming for at least 2.5 cups of fruits and veggies, ideally that 3.5 cups, then we should be getting what we need in terms of these phytonutrients. But just to give you some plant foods examples in each category, I've created this slide here just as an extension. And I just really want to highlight again just the wide variety of foods. It's not just our plant food, or excuse me, our fruits and vegetables. Things like black rice or sweet potato or lentils, for example, are other plant foods that aren't fruits and veggies will also give you a lot of these benefits. If you want to take a look at these a a little bit more in depth, I can come back to them at the end of the presentation, or also remember, as Lauren shared, this presentation will be on the YouTube page. So some practical tips to help us increase our plant foods. Number one, prioritize getting a fruit or a vegetable at every single meal and also using our snacks as a great chance to get fruits and veggies in. A lot of what we recommend is really aiming for at least half the plate to be a fruit or a vegetable, but just starting with one is a great place to start. We also recommend aiming for legumes. So again, extending past our fruits and veggies, chickpeas, beans, lentils. These can be added to soups, salads, casseroles. Some of them can be roasted or just eaten as a snack. Same thing with our nuts and our seeds. These can be put in yogurt, smoothie, oatmeals. They could be sprinkled on top of our salads or again had as a snack. If eating raw or whole foods is not something that your GI system or maybe your swallowing function can handle, then we can try smoothies. Packing in lots of great phytonutrients. We can sneak in a fruit, we can sneak in a leafy green, maybe cauliflower rice or avocado to make it creamy, as well as anti-inflammatory herbs and spices. So we often forget about our herbs and our spices, but our herbal teas, cooking with things like our cinnamon, our paprika, those also are coming from plants. While they might not give you much fiber, they will give you some of those phytonutrients that we're looking for. Choose whole grains whenever possible. So this doesn't mean we can never have the refined grains or the white flour, but if there's an option for a whole grain product, like whole grain bread, whole grain crackers, or if you want to choose just a straight grain like quinoa or oats, then that would be a great opportunity to get more of that fiber in. And then incorporating olive oil instead of butter. Again, not that you can never use the butter, but olive oil does have some anti-inflammatory properties thanks to its healthy fats. And I think it also has vitamin E in it as well. So speaking of healthy fats, these, especially our omega-3 fats, have been linked with lower risk of chronic disease and fighting inflammation. So omega fats, there's several different types. EPA and DHA are two that are anti-inflammatory, and we can get those in a lot of our cold water fish. So salmon, sardines, tuna, trout, anchovies, those are all going to have more omega-3 fats than our warm water fish, like a catfish or a mahi-mahi. You can also get some omega-3s through some of our plant foods, namely a couple of our seeds. Chia seeds, hemp seeds, and flax seeds are great options, as are walnuts. So if you need a salad or maybe an oatmeal or a yogurt topper, those are my go-tos to start adding. You could also get it from seaweed or algae oil. Not super common in the standard American diet, but it is a little bit more common in some other cuisines. So if you're not a big fish folk, you don't love fish, but you like some of these other foods, I would recommend incorporating them a couple days out of the week. So now that we have kind of built our diet, we're getting lots of plant foods, we're getting healthy fats, we're limiting our ultra processed foods. What else can we do to help lower inflammation? Well, to start, we know that we can maintain or work towards having a healthy body weight. We see that excessive fat tissue can lead to inflammation through many different mechanisms, and I've highlighted just a couple here. The first one is insulin resistance. Having more fat tissue increases insulin resistance, which can lead to diabetes. It could lead to just other hormone imbalances and help us to not feel our best. Fat tissue, too much fat tissue can actually affect our hunger hormones, can actually make us hungrier. So you'll see out here on the right, having more body fat can increase inflammation by affecting hunger hormones, making it even harder to lose fat, which can sometimes be a really difficult cycle. It's one that we can break, but it does work against us. Having more fat tissue can increase cortisol, which is the stress hormone. We know having more stress is also linked with inflammation, and it can lower a hormone called adiponectin. And this is actually an anti-inflammatory and anti-cancer hormone. We see that when our levels of adiponectin get too low, we start to see increased risk of developing a cancer. The good news here, everything else we're talking about today, all of these practical strategies, the foods to eat, the changes to make, can help us to reach or maintain a healthy body weight. You don't have to lose all of your excess body fat to see benefits. We see benefit with even a modest 5% weight loss of excess body fat. So, not even total body fat. Obviously, that number is going to differ from person to person, but the moral of this story is even a little bit of weight loss can have benefit in terms of fighting inflammation. All right, regular exercise. Exercise can actually decrease inflammation by one, helping us reach that healthy body weight, but it also has been shown to decrease certain inflammatory biomarkers, so specifically some called cytokines. So we see a positive correlation with more exercise and less inflammation. In terms of what we recommend to start with, either 150 minutes of moderate exercise a week or 75 minutes of more vigorous or high intensity exercise a week. Things like walking, water aerobics, pickleball, maybe yard work, gardening, those are going to fall into the moderate category. Higher intensity or more vigorous exercise would be things like jogging and running, HIIT workouts, playing a lot of fast-paced sports. Those are going to fall into that vigorous category. I always recommend start with just whatever you can do and whatever you enjoy doing to help you move your body a little bit more regularly. Also, sleep. Higher quality sleep is linked with lower inflammation, reduced risk of chronic disease, and it can even help us to make better diet and exercise choices. When we feel more well rested, we feel like we have the capability to spend that extra few minutes meal prepping or to go on an extra walk or get a workout in. When we're drained, when we're exhausted, it's much easier to default to ultra processed foods or being more sedentary. Some tips for better sleep. Scientists, researchers on sleep are pretty united in that they recommend a consistent sleeping schedule. So going to bed and getting up at close to the same time every day. Limiting caffeine after 12 is great. Caffeine has, I think, about a 9 hour half-life. I might need to be fact-checked on that, but it's several hours. So if you're drinking caffeine after 12 p.m., it might be affecting your sleep later in the day. Limit blue light exposure before bed. So looking at your phone, looking at other screens. Avoiding alcohol. Even one glass of alcohol can affect our sleep quality. Exercising regularly is shown to help improve sleep. And then also just making your bedroom a safe space. So sleeping in a cool, dark room, avoiding working or being really stressed out in your bedroom if possible. All of these things can help signal to your brain that when you enter your bedroom, it's time to wind down and it's time to sleep. So sleep, of course, will also help us to manage our stress. As mentioned earlier, prolonged stress can increase inflammation. Some practical tips here. Number one, identify your support system. Could be your family and friends. It could be your support group, the CSC or elsewhere. It could be maybe your church or your pickleball team. It could be anyone that you feel like really supports you and helps lower your stress. Exercise, again, high quality exercise helps so helpful with balancing our stress hormone, working out some of that nervous energy, sleeping once again, prayer, meditation, maybe gratitude journaling, or even brain dumping. This is a great tip if you struggle with a lot of stress thoughts at night. Before you go to bed, before you wind down and enter that safe space, write everything out that's in your brain, get it out on paper, and then you might be able to sleep better or just have less stress. Unplug from social media. If you need to take a break from the news, if you need to take a break from social media for your mental health, that can always be a great idea. And then spending time in nature. There's some fascinating research about being outside, breathing in fresh air, breathing in, the compounds released by plants. Putting our feet in grass can help us to really reduce stress. Okay, and then I believe this is our last lifestyle factor, getting some vitamin D, but getting it carefully. Of course, we're trying to limit cancer risk. We're not trying to get sun cancer here, or skin cancer rather. But vitamin D is a nutrient that our body produces from the sun. It's an immunomodulator, meaning it really helps impact our immune system. There are vitamin D receptors present in many of our immune cells. And low levels of vitamin D are linked with higher levels of inflammatory markers. We also see reduced immune system with low levels of vitamin D. And we do see a lot of individuals who are diagnosed with a cancer have low vitamin D. You always want to go by your physician's advice on how long to spend in the sun, as well as any supplements that you might take, but it can be helpful to monitor your vitamin D levels in your annual physical to see how you're doing. We might need that supplement. We might need to increase vitamin D rich foods. Or see if there's another route to get that vitamin D. Sources of vitamin D in the diet include fortified juices, fortified milk products, salmon, and also UV exposed mushrooms will give you some of that vitamin D. Again, a vitamin D supplement might be right for you. Always best to check with your doctor that wherever you're at in your cancer treatment or with any other medications, it's safe to take it. Okay, in conclusion of everything we've talked about today, inflammation might be the result of one particular cause, for example, smoking, or many factors that add up. When it comes to fighting inflammation, we can rarely exactly pinpoint the cause of it. So, what we want to do is try to holistically address our diet, our lifestyle, practice patience, and practice consistency to see the inflammation lowered. Everyone's going to be different in their response. Some people might take a dietary change, maybe cut out something that doesn't serve them. Maybe they have an allergy or an intolerance that was increasing inflammation, and they'll find immediate relief. But for other folks, it's going to take a little longer. Start by focusing on a few powerful changes at once. So if you know that you need to kick your smoking habit, maybe start by directing your energy and attention on that. Maybe joining a smoking cessation support group, or really just focusing on that first. If you know that you're not getting anywhere near 2.5 to 3.5 cups of fruits and veggies, maybe we start there. Or if we're very sedentary, if our jobs have us sitting, and then maybe we focus on adding an exercise. So just pick where you think you're going to get the most bang for your buck, start there, and then we can continue to expand.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.